Good morning, good afternoon, good evening. Welcome to the Patient First channel. This is the channel where the patients are the kings and queens. The healthcare facility is their kingdom. We doctors and nurses are their servants. I wish every healthcare practitioner will have this mentality towards patient care. With that, we can give the best of the best to our patients. Welcome to today's episode. So the previous episode, I talked about all you need to know before seeking health care in Ghana if you are coming from Liberia. And if you haven't watched that episode yet, click the link below to check it out. And if there is any comment you need to make, if there is any suggestion you need to make, I'm always open to take comments and suggestions. We'll be addressing concerns that were raised from previous episode, and then we will be talking about the 37 Military Hospital, University of Ghana Medical Center. Also going to be introducing the upcoming episodes where we will be talking about medications that are covered on the National Healthcare Insurance of Ghana. And then after that, we will be talking about how much doctors make here in Ghana and why Ghanaian doctors are leaving and their numbers to the UK, the US, and that of Australia. After all the first video, let's look at the concerns that were raised. The first one came from most of my bosses, the residents, senior residents, some of the consultants, like they are watching the videos. Why I didn't mention Kolebu VIP section, but we are sorry why. Kolebu do have our VIP section. In the VIP section, there is usually a restriction to some nutrition. In the VIP section, you get the best of the best. With a teaching hospital, once you come here, you have medical students that will be out there waiting to talk to you. You have house officers, medical officers. You have junior resident, and consultant. So you have a lot of people talking with you. Within the VIP section, there are some limitations. Medical students, nursing students don't have access to that facility. Even most often you have residents, you have consultants coming around to check on you. That's the unique thing about the VIP section. Fully furnished, self-contained, you have everything in there. So nursing care is optimum. You will be treated like a boss. The orthopedics department has a VIP section. Really, really, really unique. You get the best of the best and you stay there, fully AC. The ONG department on the 6th floor of the maternity block. That's where you have the VIP section. And there you get the best of the best. Patient care is optimal. It's just a whole section of the hospital allocated to VIPs. It always comes with a cost. Cardiothoracic unit is a private entity within Kolebu Teaching Hospital. It's not under the government, so everything is cash and carry. But they provide their patient with the best care, even though it's extremely expensive, but you get the best care ever. Even if you want the nurses to brush your teeth, they will do it for you because of the money you are paying. 6th floor at the surgical block, allocated for VIP patients. The second point that was also raised came from one of the Liberians consultants or senior resident here. So you listen to what he has to say.
Elton, thank you for the initiative. I saw the video. It's a nice video. Let me submit a few imports. First and foremost, before coming, after seeking the medical care in Liberia, they should try to establish contact with the receiving medical center here in Ghana, preferably a health worker. And what they're trying to do is to share whatever medical information they have. Example, it could be an imaging, MRI, CT scan, it could be a lab report, a pathology report, whatever medical evidence document that they have, they can share it here so that it can be reviewed by the doctor, and then advice could be given to them. And even price estimation could be done, even the duration of stay could be done based around the medical report. One caution here I would like to highlight is an example: someone has suffered a stroke, a CVA, and then you still want to travel to come to Accra. In the acute phase, there is nothing much we can do. There is a permanent and irreversible issue that has happened. It's mostly the rehabilitative phase. If you're able to get a comment and advice from your doctor here in Ghana that based upon your report, this is what we have seen in the acute care, then the family will be convinced that they don't have to travel to come. But sometimes because they don't have this conversation, they are thinking that when they come to Ghana or travel outside Liberia, the opinion or the advice will be different. If they could get this advice online, it will help them.
Please, after doing all that, make sure you write a very good referral letter. There are referral letters and also there are medical reports, so there are two different things. So if you write a very good referral letter, it's accepted and the patient won't have to go to a referral facility where they have to go through a full evaluation process before referring them to Kolebu. Just something I'd like to add up to that. A lady coming from Liberia that her son had a burn, perhaps let's say 2nd to 3rd degree burns, and he's been in hospital for 2 to 3 weeks now, and there has been no improvement in his care. And they were seeking advice as in whether to bring the patient here to Ghana to seek further medical care, to seek health care here based on how much you can afford. If you can afford the cost of health care in Ghana, I will advise you to bring your patient here. Kolebu has a reconstructive plastic surgery unit, and that of burn unit is one of the best in Ghana and in West Africa. You have senior residents, you have consultants, you have professors with decades long of experience. If you really want to make sure that this child gets the best that he or she can have, this will be the best investment you can ever make in this child. And the last point that was also raised from the previous episode, a lady also commented that she wants to seek medical care here in Ghana for some gynecological issues. Area we don't have shortage of ONG specialists. We have a lot of them in Liberia. I'm sure they can sort out every obstetrics and gynecological issue now in Liberia. The Liberia College of Physicians and Surgeons are producing a lot of specialists in that particular field. I'm sure they can handle whatever complaints that you have. That's just my honest opinion. If you are coming here because of fertility issues, this is one of the best places you can get. If you are coming here for IVF, you get the best. I know of people coming from the US, the UK, some even from Australia coming here to do the IVF because it's much more cheaper here as compared to the US, UK, or Australia. So come here, do the IVF. If successful, they go back at a very affordable cost. Something I would like to bring to the attention of our people. I just completed my obstetrics and gynecology rotation for 6 whole long months. And what I've observed there, most of the cases that were referred here to that department, that is the ONG department, especially the gynecological cases, cervical cancer was at the topmost cause of referral. And I know of a consultant who, once she sees a Liberian female complaining of gynecological issues, the very first thing she will recommend is the pap smear and that of the HPV testing. From her experience, most of the cases that come from Liberia with gynecological problem usually screen positive for cervical cancer. And I want to look at the statistics. It's there. Cervical cancer is the number 1 cancer now in Liberia that is killing our women. And it's something that I must commend the Ministry of Health. Now we have introduced the cervical cancer screening now in most of our public health facilities. And we've even gone as far as introducing the cervical cancer vaccination within our national vaccination schedule, which is something that we must all applaud the Ministry of Health. This is one of the greatest news coming from there. 10, 20, or 30 years from now, we may likely eradicate cervical cancer for Liberia. But the story is different when it comes to Ghana. Everything concerning cervical cancer is cash and carry. The cervical cancer screen, you pay for it. The HPV testing, you pay for it. You pay for the vaccination. 10, 15, or 20 years from now, there's still likelihood that cervical cancer will stay because it hasn't been introduced into the national vaccination schedules. Everything is based on who can afford. And there are a lot of Ghanaians who cannot afford those screening and vaccinations. Now they offer two kinds of vaccination for cervical cancer. You have the silver Rex and that of the Gada cell.
Subscribe.
There's something I really wanted to clear the air on cervical cancer. Let's go to the Viral Hospital that I promised from the previous episode that I will be discussing. Now let's look at 37 Military Hospital. 37 Military Hospital is a teaching hospital now where the trained postgraduate medical practitioner, that's a resident, and it's about, I think it's a 200-bed hospital, and they offer most of the services. Did my surgical rotation also there, I think, for a week or two. It's a very nice area. These are the services that they offer.
Grab a sweetheart and spin out with them. Do the hold down and get into it. Take it to the left now and dip with it. Don't throw down. Take a sip with it. Now lean back. Put your
Yeah, I'm going to talk about the University of Ghana Medical Center. Like I said, this is like a European hospital in Ghana. It's one of the most beautiful hospitals you can ever seek healthcare from. It's stationed at the University of Ghana campus. That's Legon.
Right now, I just need you to get real loose. Get comfortable. Grab your loved ones, or grab your love partner. And if you're by yourself, no worries. Just follow after me. Gonna do the two-step, then cowboy boogie. Grab a sweetheart and spin out with 'em. Do the hold down and get into it. Take it to the left now and dip with it. Don't throw down. Take a sip with it. Now lean back, put your hips in it. Let's have some fun. That was not so bad. That was not so bad, was it? That was not so bad. That was not so bad, was it? That was not so bad. That was not so bad, was it? That was not so bad. That was not so bad, was it? Gonna do the two-step, then cowboy boogie. Grab a sweetheart and spin out with 'em. Do the hold down and get into it. Take it to the left now and dip with it. Don't throw down.
Thank you so much for watching. Please don't forget to subscribe to the channel. In the next episode, we're going to be talking about medications that are covered on the National Health Insurance of Ghana. For the very few months I've been practicing medicine, I've come to realize that affordability is a serious issue when it comes to seeking healthcare. If there is something that we can do as healthcare practitioners, is to prescribe most of the medications that are on the National Health Insurance. And I can tell you that a lot of doctors, nurses don't even know the full coverage of this medication. Okay, if you know these medications, you can help your patients a whole lot when it comes to the affordability.
Thanks for watching.
Subscribe for free.
Next episode loading.